very small humanitarian response today. So it means that, for instance, in Khartoum, very few actors are still working in very difficult situation and conditions. All around the country, for very different reasons, also very few actors, very few funding, very few interests in this conflict we feel at the moment.
We hear about a very disturbing situation in Khartoum where a lot of healthcare professionals are saying there are very few hospitals that are taking care of the wounded, taking care of the sick, taking care of those who need, medication for chronic illnesses. Could you give us a scorecard of how many health centers are really operating in the capital, the twin cities of Khartoum, Omdurman, and Bahri?
So now it's less than 30% of the total healthcare centers and hospitals which are really working. On top of this, even the one working, we are facing issues. So, for instance, as MSF, we are supporting several facilities, but we have issues with having drugs and supplies arriving there because they are stopped also on the road. So, or we don't have the authorization. So even the 30% I'm speaking of are really not functioning 100%. That's the first thing. Second thing, also the patients have really difficulties to get to the facilities because of the insecurity, of course, in the city. So it means that globally, the whole health system inside Khartoum is really not working properly and really with poor conditions. Very few also health professionals are still working inside Khartoum. So even inside the facilities working, now you will find very few of them being able to work, meaning that all of the medical staff still working, they are working around the clock, based almost in the hospital, most of them, and just working day and night.
And how about other towns? Talk about Madani, where you are, talk about Al Fashir, talk about Gadarif, and other places that are far from the capital. What is the situation looking like over there?
So there are different situations depending on where you are, for sure. But if you speak about other cities, they are also facing issues. Why? Because they are facing issues of lack of drugs in general. So, for instance, pharmacies are almost empty. Prices are getting crazy. So even if you have you have chronic disease, you have to go to pay for your drugs. It will be difficult. We are facing in Gedaref, for instance, we are facing cholera cases. So it has been already declared cholera cases there in Gedaref. We have suspected cases of cholera in other cities like Wad Madani or Khartoum. So this is also a situation that when outbreak is starting, it's even difficult with the poor resources we have at the moment to really respond to all this.